Good evening. Myself, Dr. Pallabesh Pramanik, MBBS from Nilratan Sarkar Medical College and Hospital, and MD Medicine from Bankura Sammilani Medical College Hospital, West Bengal. Now I am practicing consultant in Kontai, Purba Medinipur, West Bengal. Today I am discussing the topic, the role of stress in exacerbating acidity, which is the most common and important topic in our day-to-day practice. I discuss the topic into the following points. First is background, definition of acidity and stress, and introduction, theology, and how stress can cause acidity or acid reflux, and management, and conclusion. First, background. In recent decades, there is an increasing association between association has been noted between stress and acidity. Stress and acidity. This is and our knowledge about the pathophysiology relationship is constantly evolving. The relationship between emotion and gastric motility has been discussed, documented since the 19th century and beginning of 20th century by Charles Cabanis and William Benmont. Thereafter, the Ivan Pavlov, Walter Cannon, and Stuart Hall, who are the pioneers in determining the gastric response after an emotional stimulus in animal model. So the first is definition of the acidity or acid reflux or GRD. Gastric esophageal reflux disease, backward flow of stomach and duodenal contents into the esophagus, leading to symptoms like acid reflux or regurgitation and heartburn. Additionally, it can give rise to extraesophageal manifestation like abdominal distension and hiccup, coughing, and difficulty in swallowing. And second is stress. As definition of stress can be defined as a state of worry or mental tension caused by difficult situation. Stress is a natural phenomenon, natural human response that prompts us to address challenges and threats in our lives. Everyone experiences stress to some degree. The way we respond to stress, however, make a big difference to our overall well-being. The stress is an acute threat to homeostasis of our body and shows both short and long-term effects on function of our gastrointestinal tract by alteration of brain-gut axis, ultimately leading to irritable bowel disease or irritable bowel syndrome and peptic disorder and gastroesophageal reflux disease, etc. The major effects of stress on gut physiology include alteration in gastrointestinal motility, number one. Number two, increase in visceral perception. Third is changes in gastrointestinal secretion. And fourth is increase in intestinal permeability. Fifth is negative effects on regenerative capacity, gastrointestinal mucosa and mucosal blood flow. And six is negative effects on intestinal microbiota. Mast cells are the important effectors of brain-gut axis that translate the stress signal into the release of wide range of neurotransmitters and pro-inflammatory cytokines, which may profoundly affect the gastric acid production is necessary for the body to digest food and break down the nutritional components into absorbable amino acid, carbohydrate, and fat. Most of the acid is produced when gastric pH stimulates the release and activation of various digestive enzyme. The stomach is a relatively acidic environment with a pH of less than 4, and which one can drop to with parietal cell, live in fungus and body of the stomach and secrete hydrogen ion. These predominant substances stimulates hydrogen ion secretion, neurotransmitter acetylcholine, gastrin, etc. This regulation of the above mentioned mechanism resulting in hemorrhage or erosive gastropathy, also known as stress gastritis. The mucosal barrier is disrupted secondary to an acute illness. Next is the etiology. The altered pH can disrupt homeostatic digestion and resulting in dysregulation of gastric pH. In the critical setting, the dysregulation of is typically due to physiological stress, leading to inflammation of the stomach, known as stress-induced gastritis. In the stress state, elevated level of acetylcholine and histamine resulting in increased acid production, thus including gastritis. Patient with typically found in surgical units of hospital or in the medical and surgical intensive care unit. They are typically undergone physiological stress related to severe trauma, severe burn, ventilation dependency on intracranial trauma, physiological stress leading to a stress gastritis resulting in gastric erosion known as curling ulcer, erosion secondary to cranial etiology are named as Cushing ulcer after the famous neurosurgeon Harvey Cushing. The first step in the development of stress-induced gastritis is decreased mucosa resistance from a toxic radical. The stress response of the body results in the decrease of gastric renewal, leading to atrophy of the gastric mucosa. Blood flow to the stomach decrease and makes the stomach more prone to acid peptic ulceration and hyperacid secretion. Can stress cause acid reflux? Stress can contribute to the development or worsening acid reflux syndrome. While stress may not directly cause the acid reflux, it can trigger its symptom. When someone gets stressed, their body undergoes various physiological changes, including increased heart rate, altered digestive function, and release of stress hormone like cortisol. These stress-related changes can affect digestive system and potentially lead to acid reflux. How can stress affect the lower esophageal sphincter? Stress can affect lower esophageal sphincter in several ways, potentially contributing to acid reflux. The lower esophageal sphincter is a ring of muscle locating at the junction of esophagus and stomach, and its primary function is to act as a valve that prevents stomach contents, including stomach acid, from falling back up to the esophagus, backflow of the stomach content. Increased LES relaxation. Stress triggers the body's fight or response, which involves the release of stress hormone like cortisol. These hormone can lead to relaxation of smooth muscle, including those in the LES, lower esophageal sphincter. When the LES relaxes more than it should, it becomes less effective in maintaining the barrier between the stomach and esophagus, allowing stomach acid to reflux into the stomach. By altering the nerve signaling, stress can influence the nerves that control the function of digestive system, including LES. These alter the nerve signal can affect the coordination and strength of the LES, leading to improper functioning and increased risks of acid reflux. And by delayed gastric emptying, when somebody is stressed, the body may direct blood flow away from the digestive system to support the fight or fights. In response, it can result in delayed gastric emptying, and where stomach takes longer to empty its content. When the stomach is overly full, it increases the pressure on the ileus, making it easier for stomach contents to reflux into the esophagus. Increased stomach acid production. Stress can stimulate the release of certain chemical, and that increase the stomach acid production. Excess stomach acid can overwhelm the ileus, making it more likely for acid to reflux into the esophagus. Now, how can stress increase stomach acid production? Stomach stress can increase stomach acid production through body stress response activation. When an individual experiences stress, their body releases hormone, including cortisol and adrenaline. These hormones initiate a cascade of physiological changes to prepare the bodies to perceive threats. One of the challenges involves the stimulation of gastric acid secretion in the stomach, stimulation of vagus nerve, release of gastrin, impact of prostaglandin, and delayed gastric emptying. Now, can stress make acid reflux symptom worse? Increased stomach acid. By increased stomach acid production, weakening of lower esophageal sphincter, and delayed gastric emptying, alter gut motility, unhealthy coping mechanism, and hypersensitivity to pain. Mechanism can worsen acid reflux symptom. The management and treatment. Management, how to manage the acid reflux symptom, acidity, by stress gastritis. There are various mechanisms managing the stress effectively that can reduce the acid reflux symptom. There are some strategies to help manage the stress and improve acid reflux symptom. Engage in relaxation techniques such as deep breathing, meditation, and a progressive muscle relaxation or yoga. These practices can help calm the mind and body, reducing stress and promoting overall well-being. Physical activity, 30 minutes of brisk walking 5 days in a week, and ensure you get enough restful sleep. Overnight sleep, minimum 7 to 8 hours sleep, may decrease the stress and can reduce the acid reflux symptom. Organize your daily activities to reduce the unnecessary stress, prevent feeling of overwhelm. Adapt a balanced diet of fruits, vegetable, whole grain, lean protein. Avoid trigger food or limit your intake of caffeine, alcohol, and spicy and fatty food. They can aggravate acid reflux. Drink plenty of water throughout the day, and dehydration can exacerbate stress and digestive issues. Talk to friends, family, or a mental health professional about your stressor, and sharing your feelings and concern can help you gain perspective and reduce emotional burden. Limit caffeine and alcohol as they can contribute to stress and trigger acid reflux symptoms. Medical treatment onset of improved critical care has decreased the incidence of stress-induced gastritis. Main stay of the treatment is PPI, proton pump inhibitor administration, and second line is the use of histamine blocker. The PPI such as omeprazole, domperidone, irreversible inhibitor, hydrogen potassium ATPase. The result of that in decreased hydrogen ion secretion regardless of levels of acetylcholine and gastrin, as the drug directly inhibits the enzyme. Now, conclusion. In conclusion, while stress may not directly cause acid reflux, substantial evidence supports its role in exacerbating the condition and triggering symptoms. Stress can influence various physiological factors, all of which can contribute to acid reflux. Moreover, stress-induced behavior such as unhealthy eating habits and coping mechanism may worsen acid reflux symptoms. Therefore, managing stress through relaxation technique, regular exercise, proper sleep, healthy eating, and seeking support can be instrumental in reducing the impact of stress on acid reflux, promoting better gastrointestinal health and enhancing overall well-being. Thank you.